So do it with me at the minute. I'll get you just to pop your hand on your head, maybe just to rest it there. We use the whole of your hand and cupping it right up into your armpits, usually what I would get people to start with. When you do that, you're really trying to get into this sort of pocket around your shoulder blade, I guess, is the spot there, and coming with a stroke down your body. So the idea here is that we're trying to move fluid, probably more so down towards lymph nodes down in the groin. So we're just having that idea of taking fluid away from that spot where it's built up. Nice and slow. Just with that pressure of patting a cat. And next we're going to try and clear out moving some of the fluid from this armpit towards the lymph nodes in the other armpit. So what I'll get you to do, Carol, is to cup your hand right in under your armpit there, and then to slowly bring your hand across your chest, still using the whole of the flat of your hand coming right across your chest. Beautiful. And the last spot where we'd try and clear fluid is probably up towards the neck a little bit. So coming up through the chest. That's good. So usually in all of those sections, so we talk about down the side of your body, across your chest, and then up towards your neck, we get you to do something like 20 strokes. Just those light, easy strokes, moving the fluid away from that spot where it's all built up. And once you've done that, then we start to get you to move down the arm a little bit. So usually I divide the arm into about 3 sections. So you start by bringing fluid up probably over the top of your shoulder, and probably concentrating your strokes anywhere that you feel you've got a little bit of build up. So commonly people find that they've got a little bit of fluid that builds up right at that elbow spot. So working to move that fluid up and away from those areas where we know that it's that bit more blocked. And then further down through the forearm. And some of those strokes from the forearm I'd take all the way down, even all the way down to the groin, all the way up to the neck. And then lastly we do some strokes through the hand, and again doing some of those longer strokes as well. Again, focusing your massage on where you feel you've got the worst sort of symptoms. One of the things that we know can make massage a little bit tricky is having scar tissue. So if you've had treatment for radiation in under your armpit in particular, or if you've had a mastectomy, for instance, the scars that are left can be quite large. Essentially, fluid doesn't really move through scar tissue very well. So what I'd encourage people to do is, if you have a scar, is basically to try and work your massage strokes around those scars. So we're not trying to push fluid through a scar, we're trying to kind of bring it up and around. Yep. The other thing I'll mention just with massage is that there are a few times when massage is something that we actually encourage you not to do. We've talked a little bit about infection. Another time is when you're undergoing radiation treatments. So skin that has had radiation treatment to it becomes really fragile. Another thing we're trying to avoid at that stage is breaking the skin or creating any spot where infection could get into your body. So we definitely get you to avoid any massage on skin that's being radiated or on skin that you think might be at risk of having one of those big infections there.